In sleep apnea, in obstructive sleep apnea. Thank you.
Hello? Perfect. Good morning, dear Chairman, dear colleagues. It's a great pleasure to talk about the innovation in OSAS treatment in this international and prestigious context. I am Manuele Casale from Campus Biomedico University of Rome. The Campus Biomedico University was founded 25 years ago, and it's one of the most modern universities in Europe. It's very, the main characteristic is the close relationship between medicine and bioengineer faculty and a great alumni association network. This is our integrated sleep surgery team. There are sleep surgeons, but not only sleep surgeons, bioengineer, allergologist, neurologist. We usually organize at least one sleep surgery course each year, and we have a great panel of medical students and fellows that work with us. So, speaking on novel treatment in OSAS, it's very interesting because the background is interesting. We have a lot of companies that push many devices to try to solve sleep apnea, but we have also prestigious sleep medicine societies that invite us to be careful to suggest these new tools, because in many cases there are not good validation, and so last but not least we must follow the guidelines. So it's very difficult to navigate in the sea for us. I don't have conflict of interest. So first of all, OSAS is still underestimated disease. And we know, according to this study from Milan, from Bocconi University, that only 4% of estimated prevalence are diagnosed, and only 2% of estimated prevalence are treated. So if we still have only polysomnography to diagnose our disease, it's very difficult to solve the problem of diagnosis. So 2 years ago was born in our department a telemedicine service with WatchPath 1, and we are very happy, the patients are very happy, and it's possible to reach all parts in Italy and in Europe, and is now one of the most important service of telemedicine for the center and southern Italy. WatchPath 1 is validated by a lot of important papers and is approved by important sleep society. To increase the number of diagnoses, it's possible that the app and new technologies can help us in the next future. With this app, Sunrise, it's possible to diagnose sleep apnea through machine learning, monitoring the mandibular movements. So about the treatment, we have a roadmap. According to guidelines, we have CPAP, MAD, and surgery. So the new tools are complementary therapies or a therapy in case of absence or partial answer to conventional treatments. We know that CPAP is a goal, or better, the first line standard treatment for symptomatic or moderate to severe OSAs, but there is a low compliance. And according to these quick calculators, the star CPAP patient has only 40% of a patient needed sleep. So it's mandatory to increase its compliance. And now it's possible to get more comfortable mask. We know that mask is one of the most important problems in CPAP patients.
I want you to look up.
We can,
Look,
I
head
don't
up,
know
tilt
if
your
it's
head up.
possible to,
Okay, tilt, a little more.
to listen to the audio.
There. So it sort of made a
So
facial.
it's possible with
and if you don't
with
go right, you can make sure that it's a better measurement. But basically, when it measures the height and width, basically you're going to find.
It's
Bring a list
possible
of
with
what
this
we
app
have found that fits your height, width,
to
and
have
depth of nose. What
a
fits
customized mask.
this mask.
Okay, it's possible to high volume, thank you. This is apps, we know that it's very difficult to follow CPAP patients, so we have apps to ameliorate the follow-up in these patients. According to MAD, it's very important, according to us, to consider this thermoplastic mandibular advanced device. So it's a low-cost device, very useful to predict the efficacy of customized MAD, because customized MAD is not cheap, and often it is suggested before titration of MAD. So maybe this kind of MAD could be an interesting bridge. About surgery, the surgical treatment for OSAs is very extensive, but now we explore the novel treatment, in particular in nasal and pharyngeal surgery. We well know how nasal obstruction can cause sleep disorder breathing, and we well know that nasal obstruction reduces compliance of almost all OSAs treatments. So, in the nose and sinus surgery, the present but the future is the awake rhino-sinus surgery. We, for many years, that we have been doing surgery both at Campus Biomedico of Rome and at the Clinica Universidad de Navarra, our bigger sister, with Professor Peter Battista, my mentor and my dear friend. And, but we want to ameliorate and to increase this kind of surgery in our departments. So we would like to show you Latera. Is a device to increase the stiffness of internal nasal valve. This is a video.
Nasal breathing provides more than 70% of airflow to the lungs, and it filters air and helps us extract more oxygen from each breath. When patients with nasal obstruction breathe in, the side or lateral wall of the nose can collapse inward, causing large changes in airflow and quality of life consequences. Now, ENTs have a novel option to address this collapse by supporting nasal upper and lower cartilage. A small cannula is inserted just inside the nostril. When the cannula tip reaches its target, a clear, thin, absorbable implant is injected into position. The cannula is removed, and the clear implant provides ongoing support, preventing nasal valve collapse and delivering relief from nasal obstruction symptoms.
Okay, and there are a lot of papers about the efficacy of Latera in this kind of patient. Another tool is COS. There is also a little video. So COS is very mini invasive surgery that may mitigate symptoms, especially rhinorrhea in patients affected by nasal obstruction. It's very mini invasive tool. It's okay. Few minutes is enough for the procedure. Okay, and the first results were very good. It's interesting the reversibility of the effect on the nasal nerve. It's very important to consider, like novel treatment, the use of balloon sinus dilatation in local anesthesia in chronic rhinosinusitis without polyps. And it's important too, we have a good experience to perform mini-invasive surgery under local anesthesia for polyps. It's very interesting to consider the availability to perform septoplasty under local anesthesia in selected patients, especially with anterior deviation and in obese patient. No anesthesiology falls asleep patient such index picture for septal deviation, considering the anesthesiological risks. So about pharyngeal surgery, the past is uvulopalatoplasty. With contrasting and not replicable results, and with some invalidating complications. More than 10 years ago, two giants of sleep surgery, Kenny Pang and Kelly, passed from a resective to remodeling pharyngeal surgery. A new concept that necessarily passed through an accurate patient selection. The first results were very good, and after 2 years, other two Italian giants from the north of Italy accepted the intuition of remodeling and introduced the barbed suture to increase the translocation muscle and to reduce the invasiveness of surgery, confirming the very good results as shown in these articles. These are the main advantages of barbed sutures. So there is a brief video about anterior barbed pharyngoplasty. There are a lot of barbed pharyngoplasty techniques up to date. There are some variants, but all barbed pharyngoplasty have the aim to enlarge the oropharyngeal diameters and to increase the stiffness of smooth palate and pharyngeal lateral walls. Okay, it's a underweighter surgery. The procedure lasts more or less 1 hour, and the patient typically has postoperative pain for 2, maximum 3 days. Okay. We performed a systematic review on different barbed pharyngoplasty, and we noticed a success rate, a very high success rate in most of cases from mild to severe OSAs and snoring too, as you can see in this slide. Okay? So this is the success rate of barbed pharyngoplasty according to the recent literature. So it's interesting to underline that also for palatal snoring, the introduction of barbed suture can be useful. This is our experience on patients affected by moderately severe OSAs, and according to our experience, it's possible in selected patients to avoid CPAP with this kind of surgery. But it's mandatory, a good selection, patient selection. The complication, according to international literature, are few and only minor. There are tools to reduce the invasiveness and of the surgery and the postoperative pain, like Bisact from Medtronic. And so for hypopharyngeal obstruction, we well know hypoglossal nerve stimulation. This is our first paper about this kind of surgery. On the right, you can see the start patient for external hypoglossal nerve stimulation. And according to our systematic review, we have a significant improvement and a good long-term results. Other NOMAD oral device, it's interesting, very interesting, the electrical stimulation therapy by Excite OSAs. Very interesting tool, complementary tool for snoring and mild sleep apnea, according to recent papers. Okay? There are very few contraindications. There is also external hypoglossal nerve stimulation. The results are puzzling and maybe increase arousal. So about positional therapy, the new is the introduction of up, but we well know that it's the efficacy of positional therapy to be associated with a mild OSAS, male sex, and lower BMI. There is another novel treatment, the myofunctional therapy for OSAS. This procedure is increasing. There are some systematic reviews. The results are encouraging, but we need more larger trials. And it's very interesting the introduction for this kind of therapy of hubs. So we can
la cara, siempre en posición relajada, sin mover el cuello. Sacaremos la lengua en posición horizontal y presionaremos con la punta la pantalla durante 5 segundos.
Sorry for the language.
Cada ejercicio. La lengua no debe tocar ni los labios ni los dientes. El móvil debe estar lo más alejado posible de la boca para favorecer la máxima extensión de la lengua.
Okay. So, good efficacy of, according literature, for this kind of surgery. We have also expiratory positive airway pressure, very new device. Are valves covering the nostrils that give a resistance to the expiratory airflow without influencing the expiratory one, reducing the oropharyngeal collapse. The first results are encouraging, and the they could be considered a complementary therapy to conventional treatment. So it's very important to consider the.
Acercarlo un poquito porque
Yes,
me llama la
this
atención
is
que ese puntico
this is
también-
Professor Battista. It's possible to
Ok, está perfecto.
to follow
Muy bien. Por
also
supuesto,
surgical
no quiero que se
patients.
corte, efectivamente. Dígame.
In telemedicine. So telemedicine is the present and the future according to us. It's possible to have tools to view our cavities. So it's possible to have a 4P approach also for OSAs, but keep in mind that it's a multifactorial disease and needed a multidisciplinary approach both for diagnosis and treatment. So we are waiting for at our third course on surgical innovation and new technologies in Rome next June. Thank you very much for your attention.
If there are questions from the audience, please.
Hi, I'm Pernilla Sahlström Johnson. I work at the Skåne University Hospital as a consultant, and I'm one of the co-authors to the CODATE study. And we must object that you report that this has result on the nasal patency, because we didn't show that.
More questions? I just want to ask you, Manuel, very good lecture, and thank you very much for coming. And we will probably have more meeting. We have more meeting on sleep apnea, and then we wait for this. About myofunctional therapy, do you have some experience before sending patients to surgery to do for them like the not surgical thing? If they don't want CPAP and they don't want, they cannot go with weight loss, what is the place of the myofunctional therapy? Because I
Yes.
think it's coming.
Yes, in our institution, we usually propose myofunctional therapy as complementary therapy to MAD and CPAP, and also after pharyngoplasty. After pharyngoplasty, to increase the stiffness of smooth palate and lateral pharyngeal wall, and to reduce the little symptoms like dysphagia and a sensation of foreign body in the pharynx. According to us, with myofunctional therapy, these symptoms can be reduced in a brief time.
And because the topic of this session is the role of the nose
Yes.
in snoring and sleep apnea,
Yes.
my next question is, if you have a child like 14 or 12 years old or something, or 10 years old, that he has sleep apnea, we know that we do for them tonsillectomy, adenoidectomy, but if you see a very deviated septum in a child, like 10-year-old, will you operate the nose as part of the sleep apnea if you have sleep apnea?
Yes, it's a very interesting question.
Yeah.
It's possible. You know that it's possible to operate also children of septoplasty. It's depend. It's a difficult decision to take with parents because we well know that all therapies for OSAs doesn't function very well with an impairment of nasal breathing. So it's very important to consider alternative therapies before to perform septoplasty in children, but it's possible. It's very important to consider the severity of apnea, the availability of other therapies, and it's possible to operate to operate of septoplasty children too, without problem. If it's necessary, it's really necessary.
Okay, thank you very much.